Here with reaction, the author of the bestseller Treason, former Speaker of the House, Newt Gingrich. Mr. Speaker, really, did this Freedom Caucus need to get lectured? You had a speaker that barely wanted to be seen.
Look, first of all, you hit it right in the head. The Freedom Caucus had probably the highest percentage of Trump supporters of any group in the House. They disagree about this one thing, and I think from their perspective, they probably think Trump was misinformed. Let me give you an example of something today that Nancy Pelosi doesn't get. The National Association of Manufacturers met with the president to share with him that their CEOs have the highest level of confidence in making new investments in the United States that they can remember in well over a decade. This follows other things that are going on. Despite all the noise in Congress, President Trump is making real progress, and he's getting things done. And every time you turn around, you see new signs of investment, new commitments to build things in the United States. I think that he's got to solve this legislative problem. My personal advice would be to start with infrastructure, and frankly, after the extraordinary fire in Atlanta last night, which is going to cause enormous traffic problems for the city for months.
That's disastrous.
It's a good reminder, an area you know well from the years you were down there. I mean, this is a good reminder that we got to rebuild our infrastructure. I think you start there, then you move to a tax cut bill, not just tax reform, and then you get to health care third. But right now, I think they're all gridlocked and too busy being mad at each other. They got to get over it, relax. This is the beginning of a long game. This is not the end of it. And we got lots of time to get lots of good things done for America.
No, and by the way, they've got to keep the promise. This is not optional. They can't let Obamacare implode. So, to me, it's very simple. You have to, if you're in leadership, show your members the bill before you unveil the bill publicly. Then you got to build consensus. I appreciate that there are moderates and different groups, study group, Tuesday group, Freedom Caucus. Everyone's got to work together. They got to hammer out a consensus. It would be wise for them to work with the Senate from the get-go so they don't end up in conference and the Senate bill and the House bill are two very different bills, and that then becomes another opportunity for it to fall apart. So bring everybody together, and while they're doing the things you mentioned, this can get done, right?
Yeah, I think it can get done. I also think if they do it right, they're going to shock all of us, because if you look at the collapse of Obamacare in rural America, I think Senator Heitkamp, who's a Democrat from North Dakota, might have a really hard time voting against a good Republican bill that was well designed. I think the same thing goes for the senator from Indiana, the senator from Missouri, the senator from Montana. I wouldn't automatically assume that they're just going to hunker down and decide to destroy themselves. They're up for re-election next year. And in parts of rural America, Obamacare is a total disaster, and we can do something dramatically better. And if the public understands it, which is the other half of this, the country has to believe in the bill if it's going to pass. Health is too big an issue to pass if the American people aren't with you.
But there is something to learn from this experience. I think, number one, you can't unveil a bill that nobody's seen. You have to bring the different groups in the Congress together. You should include the Senate so you don't have a problem in conference. And why would they have done it this way anyway? That makes no sense to me. Here's the frustrating part, 8 years.
Look, I have no idea how they end up like this. We used to follow a model of listen, learn, help, and lead. Or somebody once said to me, you know, you get one mouth and two ears, and there's a pretty good hint there. And I think the fact is that people, when you're doing something this big, 1/5 of the economy, life and death for every American, you need to do it carefully, out in the open. People have to have a real sense of participation. You can't ram it through, and you can't assume that a small group of people know enough by themselves. That's what Obama did wrong. That's what Hillary did wrong back in the 90s. This is a really big, complicated issue. I think it's fixable, but and it may take 3 or 4 bills, all of which ought to be understood from day one. And I think that frankly, that's part of why I would shift and look at infrastructure and tax cuts, because you can do those while you're working through what needs to be done in health care. All three could be done this year if they're willing to work with the American people and have an open legislative process.
All right, sir. A great idea. Thank you.